Throughout the pandemic, we have frequently heard about the virus's disproportionate impact on communities of color. The CDC says long-standing systemic health and social inequities have put minority groups at an increased risk for contracting COVID-19. But lawmakers are hoping to reverse some of those historic obstacles with new legislation to increase representation in the medical field. According to the Association of American Medical Colleges, less than 6% of doctors in the United States are African American. The same goes for Hispanics, but a new Senate bill worth $1 billion hopes to change that and with it begin closing the racial gap in healthcare. Recruit, enroll, and retain. That's the goal of the newly proposed Expanding Medical Education Act put forth by Virginia Senator Tim Kaine. The legislation says its mission is to tackle the lack of representation of rural students, underserved students, and students of color in the physician pipeline. Changes that could cut down mistrust in doctors and healthcare systems and close the gap in healthcare. A 2006 study from the National Institutes of Health found black populations distrust medical providers due to factors like perceived racism or greed. There's also the history of African Americans being used against their will for medical experimentation without their consent or against their will. So how could the legislation address this history? The bill would prioritize $1 billion in grant money for minority-serving institutions like historically black colleges and universities. The money would be used to create medical schools or campuses in areas that are medically underserved, are experiencing a shortage of healthcare professionals, or where no such schools are already established. The schools would be required to hire diverse faculty and staff and recruit, admit, and keep students from disadvantaged backgrounds, underrepresented races and ethnicities, rural areas, low incomes, and first-generation students. Grant recipients will have to report to Congress on actions taken with the funding. For some, the bill isn't a cure-all, but Daniel Dawes with the Morehouse School of Medicine says it's a start to an effort we should take seriously.
We'll continue to merely nibble around the edges of the problem of racial health inequities in our state, in our country, unless we diversify the health professions. If we do not do that and do that seriously.
While medical school enrollment was up 31% last year, the Association of American Medical Colleges says blacks only made up about 7% of the students and Hispanics just 6%. They're also seeing drops in enrollment in rural programs as doctors in remote communities are growing older and retiring and not being replaced quickly enough. A similar House version of the bill was proposed earlier this year in January, but has not made much progress.